This is another example of a papillary thyroid carcinoma. So low power, just to show you that this is thyroid parenchyma here as well as here. So there are two pieces. And at this magnification, I hope you can appreciate that immediately that there is this focus that stands out as being slightly bluer compared to the rest of the parenchyma. So the rest of the parenchyma shows variably sized thyroid follicles containing a lot of colloid, and they are lined by a single layer of follicular thyroid epithelium. So let's move on then to this blue focus that we saw earlier. We can see that there is some papillary architecture present, like this one here, projecting into these sort of almost dilated follicles. To confirm that, we can go on a little bit higher power, and you can see that there's fibrovascular core, which is lined by these neoplastic epithelium, and these neoplastic epithelium shows enlarged nuclei, overlapping nuclei. You can see the nuclei being on top of each other, and very striking nuclear clearing. Some of these are like absolutely clear, like orphan Annie, a typical orphan Annie nuclei in the textbooks. And as we move along, we can also start seeing that some of these nuclei contain nuclear grooves. So these are lines that traverse through the nuclei. And this is a typical feature of papillary thyroid carcinoma. Notice also how these cells are not cuboidal as per your normal non-neoplastic thyroid epithelium, but instead they are columnar. So they have abundant apical cytoplasm within them. So looking at another field, again, we can appreciate that there are numerous nuclei with nuclear grooves present here. Again, other features of papillary thyroid carcinoma which would be nice to see are pseudonuclear inclusions as well as some bodies, but they're not present in this particular section. So this is an example of papillary thyroid carcinoma.